Ever been told ADHD is just a kid's thing? Think again. Millions of adults live with ADHD every day, juggling work, relationships, and daily life with brains that feel like they're always on fast forward. New research is showing that adult ADHD isn't just real, it's underdiagnosed, misunderstood, and, for many, only discovered later in life. ADHD, attention deficit hyperactivity disorder, is a neurodevelopmental condition. It affects attention, focus, and self-control, things that most people take for granted. For kids, it might look like bouncing off the walls. For adults, it can feel like mental restlessness, trouble finishing what you start, or constant distraction. And it's not rare. About 6% of US adults have an ADHD diagnosis, and nearly half of them didn't find out until adulthood. ADHD doesn't magically disappear when you grow up. It just changes form. Hyperactivity might become that internal motor that never stops. Impulsivity might show up as talking too fast, interrupting, or making snap decisions. And that classic inattention, it's still there, but now it shows up in things like misplaced keys, missed deadlines, or unfinished projects. Many adults with ADHD describe their minds as always on, racing from one idea to the next while trying to keep life on track. Adults with ADHD often struggle with staying organized, managing time and attention, completing boring or repetitive tasks, feeling restless even when sitting still. And here's something many people don't know. Up to 70% of adults with ADHD also have sleep problems. No wonder caffeine becomes a coping strategy. Most adults with ADHD get help through primary care doctors, nurse practitioners, or psychiatrists. Treatment can include medication, therapy, or both. But it's not always easy. About 1 in 3 adults take stimulant medication, and in 2023, 2/3 of them had trouble filling prescriptions due to nationwide shortages. Telehealth has made ADHD care more accessible. Nearly half of adults with ADHD have used virtual appointments. Between 2020 and 2023, ADHD diagnoses among adults spiked dramatically. Why? Experts think it's a mix of greater awareness, less stigma, and, you guessed it, the stress of the COVID-19 pandemic, which magnified attention and emotional challenges. Still, research shows many adults remain undiagnosed, maybe as high as 14%, with women more likely to go unnoticed. ADHD looks different in women. While men are often more hyperactive, women tend to have the inattentive type, which can go unseen for years. Instead of being loud or distracted, many women describe feeling overwhelmed, exhausted, or like they're constantly falling short. They're also more likely to struggle with anxiety, low self-esteem, and perfectionism, often using coping strategies that hide their symptoms until burnout hits. If you have a loved one with ADHD, here are a few do's and don'ts. Do. Learn about ADHD. Understanding makes all the difference. Offer practical help. Even just sitting nearby while they work, called body doubling, can boost focus. Be patient. ADHD isn't about laziness. It's about brain wiring. Encourage breaks. Short pauses can keep motivation alive. Don't criticize or blame. They're not broken. Their brain just runs differently. Assume all ADHD looks the same. Ask what helps them. Try to fix them. Support, don't rescue. At work, small adjustments can make a big difference. Things like a quiet workspace, noise-canceling headphones, or flexible scheduling can help adults with ADHD stay productive and balanced. And if you think you might have ADHD, or you're just wondering, talk to a healthcare professional. Getting assessed isn't about labeling yourself, it's about understanding yourself. ADHD doesn't define who you are. It's simply one part of how your brain works, and that brain is capable of amazing things. Because understanding ADHD, especially in adults, starts with talking about it. Brains on fast forward, because our minds never hit pause.